Ladies and gentlemen, you indeed welcome to Bowers Center for Excellency. Tonight, we're having a recording of the new technology about fibroids, the treatment, and the latest technology that we've been able to get, which is going to help our fellow mothers, friends, sisters on how to fight fibroids without undergoing an operation. Now, you're welcome to look at this video, one of the first videos. We are having a number of them. And you will have to see exactly what is happening, and we can start watching.
It's a common health problem among women that can have life-changing consequences. Uterine fibroids are found in up to 80% of women. Most are able to manage, but for some, the only treatment has been a hysterectomy. Now there's a new drug approved by Health Canada that may give women an alternative to surgery. Crystal Gamansing reports.
A person's health is an incredibly private subject. Lisa Harper blogs about hers, including her struggles with uterine fibroids.
We're very comfortable as a society talking about erectile dysfunction, things like that. You see Viagra, Cialis. But when it comes to women's issues, I think everybody's pretty quiet about it.
This new drug, however, has Canadian women talking. Fibrostol has been approved for use in Canada. Tests have shown it reduces bleeding and shrinks uterine fibroids. 80% of women will develop the non-cancerous tumors. Depending on where they're located in the uterus, they can lead to severe bleeding. The most common treatment recommended, hysterectomy.
Fibroids are the most common reason for women having a hysterectomy other than for cancer, for benign reasons. So it's a huge number of women that go through surgery for this condition, and we have not had very many options at all.
The medical director for the Mature Women's Clinic and Hysterectomy Alternative Program in Winnipeg was a member of the Drug Review Board.
This drug will play an important part in the medical management of uterine fibroids.
Bleeding is the cause of the pain some women with uterine fibroids experience, and it can be severe.
This is a blood vessel coming off the wall of the uterus and covering the fibroid.
Dr. Richard Boroditsky says in addition to this new pill, there are some other options, including hormones or a procedure to block the arteries in the uterus.
But I think it's wrong for any patient and any physician to go straight to hysterectomy.
Harper couldn't agree more. She opted for the artery blocking procedure and sees the new drug as a step forward.
At least to have had an option, because I just suffered for so many years.
Suffering in silence with a common health problem that's rarely talked about. Crystal Gamansing, Global News, Winnipeg.
So, ladies and gentlemen, as you can see, this...
Hello, are you looking to buy your own car? Is it your first...
Here you are going to find a number of details that we are having and that we provide. Like you've just seen, they are tablets, pills, that have got a collection of... Okay, let us see, first of all, where does the fibroid keep on growing. Just as you've seen before, we have progesterone, we have estrogen. Now, every time these two hormones keep rotating, if one is getting high, the estrogen, we're supposed to keep them low. If only we can have the tablets that can keep it in check. Because, trust me, we have done research. I personally do a lot of digitalized healthcare research, together with a number of professors, doctors, and even patients that have undergone this kind of problem. And what have we seen? You do an operation, time comes, because of your triggering of the hormones, it comes back to you. You go for a second operation, but still you can suffer the same problem. This is what we are looking at. If operation can work, if embolization can work, and all these other technologies that we are having, if they can work, that is good. But suppose you have failed operation number 1, operation number 2, then there has got to be an alternative, because they are not going to keep on operating you now and again. Some use remedies, vitamins, supplements. It is a big package that we have to look at, understand what we have to do and when we have to do what. Now, very quickly, I want you to take a look at some of people like in India. It's going to be another very short video this time. They get any green plant which is not toxic, which does not have maybe it's not poisonous. They use it and they drain it, they drain juice out of it, and they can do exactly the best out of it. All this is what we have to learn.
First purchase